Okay, so this is part 3 for the urinary system. So by the time the nephrons form the urine, it ends up in the collecting ducts, and then this goes back to the first part of the lecture where we talked about you've got the collecting ducts will lead into those renal papillae, and the renal papillae lead into the minor and then the major calyces, which leads into the renal pelvis, which goes to the ureters. And then the ureters bring the urine to the urinary bladder. From the urinary bladder, it empties out through the urethra and then to the outside world. So the ureters themselves are about 25 centimeters long, and they go down posterior to the parietal peritoneum, just parallel to the vertebral column. In the pelvic cavity, they join the urinary bladder. So the wall of the ureter has the mucus coat, a muscular coat, and then a fibrous coat. The outer coat is the fibrous coat. Okay, urinary bladder. Difference between the male and the female urinary bladder. The female doesn't have a prostate gland, so this is a male one. The detrusor muscle is the muscle found in the urinary bladder. If you remember from A&P1, there's also all of that transitional epithelial tissue so that the urinary bladder can stretch. There's an internal urethral sphincter here, and there's an external urethral sphincter. The internal urethral sphincter is involuntary, whereas the external one is voluntary. There's cross-section, oops, sorry, wrong way. Cross-section of the urethra there. It looks very similar to the ureters, but with the addition of those urethral glands. All right, male and female urethrae. The female urethra is much shorter because it doesn't have to extend through the penis. And because it is shorter, women are more prone to urinary tract infections because any bacteria entering from the outside has a shorter distance to travel. Whereas the males has to extend through there, and like we said, the female doesn't have the prostate gland, which we'll talk more about in reproductive system. Micturition. With micturition, that's the process of urinating. The bladder is going to distend. So the bladder is going to, as it fills up, stretch receptors in there are going to be stimulated. And then there's the micturition center that's in the sacral portion of the spinal cord, which will become stimulated by those stretch receptors, or will receive the signal from the stretch receptors. From there, the parasympathetic nervous system sends impulses that causes that detrusor muscle in the bladder to contract. And then we feel the need to urinate. Voluntary contraction of the external urethral sphincter prevents urination until you make that decision that, hey, I need to pee. External urethral sphincter relaxes, the detrusor muscle contracts, and the urine gets expelled. Lifespan changes, once again, all good news all the time. So as we get older, kidney cells start to die. By the time we're 80, about a third of our kidneys have lost their mass, or a third of the mass of the kidney is gone. That loss, or that mass loss, is due to the loss of glomeruli. You get more protein in the urine, the renal tubules thicken, become less effective, and it's harder for the kidneys to clear substances. The bladder and the ureters and urethra all lose their elasticity, and then the bladder, because of that, will hold less urine. Clinical application, glomerulonephritis is when you get inflammation in the glomeruli, and it's usually due to strep infection. So and it's not really necessarily the infection itself, it's our body's reaction to the infection. So, and when our body's fighting it and you get that antigen-antibody interaction, it causes the inflammation of the glomeruli. The chronic form of the disease is progressive, and it's not usually just due to a strep infection. And then from the chronic one, you can get renal failure. That's the end of the urinary system.